Hi, I'm Dr. Scott Donovan, emergency physician and medical director for Greater Naples Fire and Rescue. I want to do a quick video to give you an idea about how to estimate the weight of the average kid based upon their age. You often won't be able to, you may not have a Broslow tape with you or may not have Hentevi. You just may be in a situation where you hear the age of the child, you know the age of the child, and you need to figure out a weight off the top of your head. So this is just down and dirty, quick way to do it. I first came up with this when I was taking online med control calls, and EMS would call in and say, hey, we have a 5-year-old here who's doing whatever. And I could say, okay, 5-year-old, 20 kilos. Or also for 10 years that I was doing aeromedical, we would be on our way to a scene to pick up a child, and they wouldn't necessarily know when they were in the field how much this child would weigh. But they typically always knew the age. They say, hey, we have a 2-year-old child who is ejected. I'm like, okay, 2 years old, probably 12 kilos. Or we have a 4-year-old child, okay, 17 kilos. And I could figure out roughly that weight on the way there and then start figuring out doses based upon that. So there's just a couple things you need to know. And from those couple of things, you can figure out, on average, the weight of most kids. So a couple of things with this. One thing you just need to kind of know is most newborns, as long as they're not preemies, weigh about 3 kilos. Give you a caveat in a second. You double at 6 months to 6 kilos. And by the age of 1, there's a 1 in 1 and a 1 in 10 kilos. Now, you can say 3.5 kilos, double it at 7. That's fine. For the most part, when we're in the field and we don't have everything else with us, we're trying to get rough numbers to treat quickly. A lot of times we're so worried about the point something of a kilo. When we're in the field, we cannot have paralysis from analysis. We need to have some quick down and dirty handy methods to be able to treat rapidly and transport appropriately. So newborns at 3 kilos, double at 6 months to 6 kilos. And by the age of 1, again, there's a 1 in 1 and a 1 in 10 kilos. By the age of 2, again, there's a 2 and 12 kilos. By the age of 3, evenly divisible by 3, 15 kilos. Pretty easy to remember. By the age of 4, I'm going to come back to this. I'm going to jump down here and I'll explain why. By the age of 10, you are roughly half of your appropriate adult weight. Now, as we get older, and if we get heavy, you may not be half of your weight at 10. But what your appropriate weight would be as an adult, you will typically be about half of that appropriate weight by the age of 10. So, by the age of 10, you're half your adult weight. Now, if you go to grab an ampule of medication out of a go bag or a crash cart, those are made up based upon 70 kilo adults. Now, many of us in America do not weigh 70 kilos. So we're a little over 154 pounds. However, for the purpose of that, that is what has been made up at, and that has been sort of a standard. So at age 10, you are half of your appropriate adult weight for the most part. So half of the 70 kilos at 10, you are 35 kilos. Now, by 4, you are 1/4 your adult weight. So half of this, so roughly 17 kilos. Now the handy thing too is that whether I go up in age or I come down this way, it doesn't matter. It's 3 kilos per year. The other handy thing about this, besides knowing the weights off the top, is if you don't happen to remember and you don't have something handy on you, though you should, to remember the doses on a per kilo basis for a child, if they're 10, you can give them half of the adult dose. Again, for the most part, with some caveats. If you look at the child and the child looks exceptionally big, you may need to tweak that up a little bit, or exceptionally small, may need to tweak it down. I may not necessarily even figure out on a per kilo basis for a 10-year-old, because I know for the most part it's going to be half of the adult dose I'm used to. Or for a 4-year-old, 1/4 of the average adult dose that I'm used to. If you can't remember other things about it, just remember that if you go to grab an amp of something, and you can do this, you grab an amp out of your go bag, out of your crash cart, if you look at the amount of medicine in an amp, and remember that it's based on a 70 kilo adult, then you can figure out, without even looking something else up, how much you typically give a child on a per kilo basis. For example, I can't remember how much lidocaine to give this kid IV. You could say, okay, I grab lidocaine out of the crash cart. It's 100 milligrams in an amp, and it's based on a 70 kilo adult, so that's 1.5 mg per kilo. So I know it's 1.5 mg per kilo, average 5-year-old, 20 kilos, so I'm giving this kid appropriately 30 milligrams. You don't even have to remember all these things or look it up. So this is a quick down and dirty way. Again, works great in the field, works great in a hurry, and for the most part, we are very worried, overly worried sometimes about the minutia for it and missing the big picture, and this is a great, handy, easy way to go. I wish you well. If you have any questions, you can please message it through the YouTube channel. Good luck. Thank you very much.